Hey everyone, so today my group and I are going to be going over various different angulations and techniques when it comes to the X-ray exposure process. The techniques we will be showing you today will be the paralleling technique, bisecting technique, and the bite wing technique. Of course, before we do anything, we need to wash our hands using our hand washing technique. Then our assistant will enter the X-ray exposure room and place on her mask. Then she will set up the X-ray tray and she will present a consent form to the patient and have them sign. She will then go ahead and place on the lead apron and then strap the thyroid collar. Make sure you cover the shoulders as much as possible and have the patient cross their legs and have them cross their arms in. So the first technique we will be discussing today is the paralleling technique. For the example today, we will be doing a posterior periapical. The equipment you will need will be a yellow XEP film holder, a universal bar, a universal ring, and then a size 2 film. Go ahead and assemble and make sure that your sensor is centered. So we are going to place the sensor on the maxillary second molar. The sensor is parallel to the long axis of the tooth and the central ray is perpendicular to both the sensor and the tooth with a vertical angulation of plus 20 to plus 30 degrees. The next technique we will be showing you is a bisecting technique, and we will be using a snap array with a size 2 film. What you will do is place the sensor film as close to the tooth as possible to create an angle between the tooth and the film. Central ray should be directed perpendicular to the imaginary bisector of that angle, and it's best to use a vertical angulation of plus 20 to plus 30 degrees. So the next technique we will be showing you is a bite wing technique. So we will be taking a posterior right bite wing. The equipment you need are a red XEP bite wing bar, and then a size 2 film along with a universal ring. Go ahead and make sure your sensor is centered. Place the center on the right side of the mouth and have the patient bite down. Your horizontal angulation is key to open the contacts between teeth. Your vertical angulation is typically set a plus 10 degrees to compensate for the tilt of the maxillary teeth.
So next we'll be taking another right posterior bite. The equipment that you will need is the bite tab and the size 3 film. Next, you will place the sensor on the patient's right posterior molars. You will then set your PID vertical angulation at plus 10 degrees. So next we will be taking yet another right posterior bite exposure. The equipment that you will need is a bite loop and a size 2 film. Once you assembled all the equipment, you will then place the film inside the patient's right posterior region. Set your PID in a vertical angulation at a plus 10 degrees.
So we will be doing another bisecting technique. Instead, we will be using the snap array and we will be using a size 3 film. So you want to place the film as close to the tooth as possible to create an angle between the tooth and the film. You will need a vertical angulation of plus 20 to plus 30 degrees.
After exposure, you will set your patient at a safe position to take off the apron. You will then dismiss your patient and proceed with the sanitation process. This includes sanitation of the cavity wipes. You will wipe down all the surface areas. You will wipe down the lead apron with Clorox wipes. Thank you for watching our video.